Welcome back to Thrani, I'm Joe B. Today I'll show you how to write a letter of medical necessity for physical therapy to reduce insurance companies' denials, maximize physical therapy reimbursement, and prevent your patient to be sent to collections. Let's dive in. A letter of medical necessity is a written explanation from a treating physical therapist describing the patient's medical need for skilled services, equipment, and/or supplies to assist the patient in treating their medical condition. This document is the format that I have used for years in the outpatient rehab setting and has allowed me to qualify for a peer-to-peer review and eventually be approved of more PT sessions as well as cover the previous sessions that had been denied. The document starts with the date on the top left-hand side, then a space below, then the address of the insurance company where you will be sending the letter to. After that, add another space below, then write RE with the patient's name so the insurance company can identify to whom this letter is in reference to. After that, add another space below, and then the salutation to whom it may concern. The first paragraph can have 3 or more sentences and is the introduction. Here, you want to start with, "I am writing on behalf of my patient, John Smith." Then follow it by indicating your request for more skilled PT intervention in the future, and please include the specific number of visits. Now, if you are writing this letter to get coverage for previously denied PT visits, then you can indicate that instead. So you write it like this: to document medical necessity of 4 more skilled PT treatment sessions for ICD code M54.2 or cervicalgia. Just note, do not forget to write the patient's referring medical diagnoses, not the treatment diagnoses. Then proceed to justifying the need for 4 more sessions by indicating the specific treatment interventions you want to add or the previous interventions you want to focus on or change to yield functional or symptomatic gains. So it goes like this. PT intervention for the requested 4 sessions will include right C7 to T1 multifidus, levator scapulae, and upper trapezius dry needling and stretching to improve sitting occupational tolerance from 3 to 4 hours. Then create a transition sentence that will convince your reader why they need to give you 4 more additional treatment sessions by providing information about your patient's progress from physical therapy. It should go like this. Below is a summary of John's current progress from physical therapy since the initial evaluation. The second paragraph can also have 3 or more sentences and is the body of the letter. Here you want to highlight the impairments and functional limitations identified during the initial evaluation, along with a selected outcome tool. If your patient has multiple problems, then you do want to highlight the ones that they have attained. The body of the paragraph should be written like this. John has been referred to our clinic and evaluated on December 20, 2023. Upon initial evaluation, John presented with right-sided neck pain of 7 to 8 over 10, limitation of motion towards left rotation and side bending, weakness of the right grip by 15 pounds less than the non-dominant left hand, and a neck disability questionnaire of 30%, with 0 being the best and 100 being the worst score. All of these impairments have resulted to a reduced sitting tolerance while working at home as a software engineer and can only tolerate 20 to 30 minutes of sitting from the usual 3 to 4 hours. Upon John's most recent reevaluation on January 21st, 2024, the pain resolved, and the left rotation, as well as side bending, has normalized with the right grip strength even better than the left hand. Furthermore, the neck disability questionnaire has improved from 30 to 20%, and the sitting to 2 to 3 hours. Interventions utilized during this time included neck traction, right grip strengthening, and neck range of motion exercises. The third paragraph will be your closing and can be comprised also of 3 or more sentences, mainly to re-emphasize your requests and why it is needed. But this time, to correlate the goal to improving the patient's quality of life. So write it like this. Additional treatment is necessary to attain the rest of the patient's goals, to tolerate working from home. Please contact our office for any additional information or documents required to ensure prompt approval of the skilled PT interventions. Thank you so much. After that, you allot another space below, then start your signature with sincerely, then add another space below, then your name and designation, along with your address and contact information. It should be written like this. Sincerely, Joseph V. Barrera, PT, DPT, OCS, Lead Physical Therapist, CC Rehab Services, Rehoboth, Delaware 19971, 302-999-8787. Email jbarrera@cchealthcare.org. Of course, you can edit this letter to suit your patient's needs, but do make sure to include the number of visits that you want to be covered, the interventions you want to add or emphasize to achieve your patient's goals, and why these goals are important to your patient. To build your portfolio to the insurance company, you also want to highlight the patient's gains that they've made symptomatically and functionally from the physical therapy sessions you've provided already. So there you have it. That's the letter of medical necessity that's pretty much has helped me and my clinic to be able to maximize physical therapy reimbursement and prevent denials. For any comments and questions, please write it down below and let's have a conversation. If you feel like the letter could be better, reach out. Let me know. Thank you so much. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.